Greetings. My name is Michael Scheib, and I oversee the Kinesiology program at Charleston Southern University. Today's tutorial will address the curriculums within kinesiology, of which there are three, as well as the possible job prospects if you choose to major in kinesiology. If you want to have any additional information concerning any of our programs, you can email me at lowercase m, as in Michael, SHIPE, at CSU, as in Charleston Southern University, NIV.edu. I'll be happy to send you information, and/or I'll be happy to speak with you on the phone or FaceTime for additional information as well. So to give you an idea of what our programs have to offer, we're going to go through a brief PowerPoint addressing some of the most prominent classes that we offer. First of all, when we're looking at kinesiology, one of our adages is that we are, of course, devout believers in that you have to use your body in order for it to function properly. Chronic disuse leads to chronic disease. And we understand, along with the quote of Montaigne here, the stronger the body, the more it obeys, the weaker, the more it commands. So we certainly challenge our students, as well as the clients that they're going to work with, to maintain a sound body, because as we know, it also leads to a sound mind and spirit in kind. So going forward here, what we have within our program, we have roughly about 215 students in the kinesiology program. We also have a public health program, and there should be another tutorial available to view it. And then we also offer one graduate program, which is our Masters of Athletic Training. It also concerns one of our emphases, as we have a 3 and 2 program that I'll address as well. So, an overview of our full-time faculty. As I said, I'm Michael Scheib. My background is I'm a registered clinical exercise physiologist, so I worked in a hospital for 8 years prior to teaching full-time. So I enjoy pathophysiology, especially lactic acid metabolism as well. And so my studies focus quite a bit on exercise physiology as well as exercise pathophysiology. Now, I worked with athletes when I was younger, but as I went through my professional ranks, I found out that I actually worked and enjoyed working more with the people from chronic diseases. They could benefit more from exercise than even most athletes. We also have 2 full-time physical therapists in our program. One is Dr. Heather Thompson, who specializes in geriatric care. She teaches several of our classes concerning corrective rehab, applied kinesiology, our senior seminar, and our introductory courses as well. Dr. Catherine Smith is also a physical therapist who specializes in pediatrics. She teaches research and evidence-based practice, applied kinesiology, and will be teaching our senior seminar classes in the future as well. Mr. Mack is a certified strength and conditioning specialist. So he oversees our strength and conditioning emphasis. He comes from over 10 years of experience as a CSCS, and he has overseen over 22 different sports as a strength and conditioning specialist. Dr. Brian Smith oversees our athletic training program, and of course is a certified athletic trainer. And the athletic training program is a master's program of 2 years, and as I noted, we do have a 3 and 2 emphases for that as well. He is joined by Dr. Seiler, who is our clinical education coordinator and also an athletic trainer. And then our third athletic trainer is Dr. Bertha De La Garza. And yes, isn't it a wonderful combination of having the first name Bertha and De La Garza? I absolutely love it. So to give you an idea, we are certainly a student-centered instructional institute. Our classes are typically somewhere from 14 to 25. We get to know all of our students on a first name basis when the first couple weeks of class. Several of the professors you will have 3 and 4 times throughout your kinesiology coursework, so we get to know you very well in terms of how you perform as a student, how we can assist you in excelling, and helping you, pointing you in the right direction of what you want to do professionally. We also want to impart to you that you have to be a model for the profession. If you are going to be working in the field of kinesiology, you're going to be championing a lifestyle in which you are very active. You need to be a model for that activity as well. And we certainly encourage our students to share their faith. The basis of what I learned in my clinical practice is people don't care how much you know until they know how much you care. I'm sure all of you have had instances where you've worked with healthcare practitioners that are remarkably bright, but their bedside manner left something to be desired, and it certainly undermined the experience. So we believe that kinesiology and the respective fields in which you work offer you a wonderful way to share your faith and your beliefs with your clientele. So we have 3 concentrations within the kinesiology program. Number 1 we're going to address is the clinical designation. Now this is for students who know they're going on to graduate school, especially for PT, OT, exercise physiology, physician assistant programs, or even medical school. So you are going to go through a gambit of science courses. It requires a full year of biology, chemistry, and physics. And of course, you will have classes within the kinesiology concentration, including applied kinesiology, exercise physiology, corrective rehab, as well as pathophysiology. So for students who want to work in the clinical setting, this is certainly the major emphasis that you would want to pursue. Another emphasis is the strength and conditioning. So now looking at training athletes, this is the major for you. It's overseen, as I said, by Mr. Mack, who has a venerable history in strength and conditioning. And so you'll be working with healthy populations, either at the high school, collegiate, and possibly the professional levels as well. So these individuals can get their CSCS certification after they finish senior seminar, which is a class designed specifically for you to pass that certification exam, and then you'll be able to practice after graduation as a CSCS. The other emphasis is the 3 and 2 program that we offer regarding a Master's of Athletic Training. So essentially, the first 3 years, you will be serving as a kinesiology student and then progress to the athletic training portion for the last 2 years. So you would finish your kinesiology BS degree your 4th year, and then your 5th year, you would finish your graduate studies. And then, of course, you would need to pass the certification or licensure based on where you're going to practice athletic training, and then you can work as a athletic trainer. Some of the courses that are shared, regardless of the emphases that you're going to pursue, is first, the introduction to kinesiology. So, and as it states, an introductory class, you get to understand the curriculum better and all the fields of profession that you could possibly pursue. We've also got Kines 211, which is a health and fitness class. We'll go over that briefly. That helps you learn how to identify people who are suffering from chronic disease, as well as fitness assessments that you can look at orthopedic and functional limitations. There's perceptual and motor learning as well, and so you'll get to learn how the body and the motor cortex interact with one another to develop coordination and gross and fine motor skills. Prevention and care goes along. It's taught by our athletic trainers and helps you identify common injuries and how to treat them in the general population. Applied kinesiology, by far and away, are the most favorite course for our undergraduate students. You're learning all the major muscle groups, how they perform, and how they can be assessed and how they're used for different activities, whether that be sports-based activities, the activities of daily life, or for rehabilitative purposes as well. Exercise physiology, I actually teach this class, and of course, the physiology of how your body adapts to exercise and what you have to do in order to maximize the optimal results for whatever goals you might have. And then you have an internship as well. All students, regardless of the emphases, complete 100 hours with a professional who's either certified or licensure or has licensure in their field to help you not only gain professional experience, but helps you network as well. So the introduction kinesiology, as I stated, you get to understand the 3 curriculums, their requirements, and the professional responsibilities. So you will have to also do a work shadow in this course, which is vital for you because a lot of students come in with the idea, I want to go to PT school, I want to go to PA school, yet the only time they've seen a PT is through injuries. They may have never really spent any time with PAs, they've just read about it. So you have to get some experience and spend a day and interview a professional in your field so that you can understand better what it takes to be whatever professional you aspire to be. The health and fitness assessment, so you will do basic tests assessing cardiac function, body composition, strength, flexibility, and some other tests that you can assess for usually the general population to help you identify shortcomings in any of those areas. Now, one of the things that you'll learn in this class is also how the body starts to adapt to exercise, at least in the fundamental level. And this is a good example here. You've got a normal 45-year-old, and of course, this is actually an x-ray showing you the width of the heart, in this case, about 10.2 centimeters. And we know that the left ventricle serves as the best pump to circulate blood throughout the systemic system. So it is extraordinarily important, not only in circulating blood, but of course, it helps dictate exactly what your functional capacity is going to be aerobic-wise. If you ever want to know who is able to run fast and who is able to run for a long time, it's whoever has the biggest, strongest heart. So you notice here we've gone from 10.2 to 15.5, a 50% increase in the heart. In other words, it's hypertrophy, just like your biceps would, just like your latissimus dorsi would, with appropriate trainer. Now, given this training is a marathoner, which would be, of course, what for some people would consider an excessive amount of training, but there are hundreds of thousands of people who run marathons every year, and when they do that, they are increasing the size and strength of their heart. So it's not uncommon to see, from going from the untrained to the trained state, a significant increase in the size and strength of the heart, especially the left ventricle. Now, perceptual motor learning, I mentioned developing gross and fine motor skills. One of the things, the concept we say is attentional capacity. You may notice when you walk and you're not listening to you're only listening to music, you're not talking on the phone, nor are you texting, you walk at a certain speed. But if I ask you to text while walking, you slow down. If I ask you to text and ask you a question to answer while you're walking, you slow down even more. So just like the bandwidth of the internet, you have a certain bandwidth in terms of your attentional capacity and the signals you can send out as you perform gross and fine motor movements. And the more I give you in terms of the more movements and the more fine they become, the harder it is for you to perform all of them simultaneously in an optimal fashion. Applied kinesiology, one of the key concepts is active insufficiency. And so with active insufficiency, if you're now sitting in your chair, if you'll put your feet directly in under the chair and lean back in that chair and try to stand up in that position without leaning forward again, what you've done is you've stretched the hamstring muscle group over two joints, the hip and knee respectively, so much that they cannot form enough cross bridges to be able to generate the force to even stand up. And that's just a basic concept that you learn in applied kinesiology. You will learn all the major muscles, how they will respond to exercise, how to assess their movement. And so it is like, as I mentioned, one of our most interesting classes. Also includes a lab as well, because it takes a lot of practical hands-on work to really learn applied kines. Exercise Phys also has a lab with it, and as I mentioned, I teach this course. One of the things that we address in this course is EKG interpretation, and when I left the hospital, looking at an EKG, which is of course looking at the electrical activity of the heart, was a $400 charge just to have that test done. Well, you're going to see the results here are simply from an Apple Watch. So now your Apple Watch, which is actually less than what it costs to have a EKG assessment just about 15 years ago, you can run as many as you want, as often as you want. And so we use this in our lab to teach how to identify abnormalities in EKG, how the EKG changes from rest to exercise, and then how it changes at different exercise intensities, and when you're exposed to things like strength training as well. And also, as I mentioned, every student must do an internship. We encourage you to do an internship exactly where you hope to practice professionally, whether that's in a PT clinic, whether it's a CrossFit, whether it's a hospital, a wellness center, or with a physician assistant. Either way, the closer you can get to your profession, the better that you can network and gain an experience that will help you to be a more viable candidate for that profession after you leave our program. So everyone will conduct this, and you will get to work with a professional, and it really helps you gain a lot of insight in the field. Plus, we ask you to treat it as essentially a 100-hour interview, because many times students are offered a full-time position within a year of completing their internship. So it's important that you choose that site wisely. So as I mentioned, you can contact me at lowercase m shipe, SHIPE, at csu.edu. I'm happy to answer any questions that you have about the program or Charleston Southern in general. I hope you enjoyed the tutorial, and thank you for your time.